In this chapter, let's learn about lifestyle intervention for diabetes. Before talking about diabetes treatment, we need to evaluate the patient's treatment targets. In type 2 diabetes, intensive glycemic control HbA1c less than 7 has been shown in RCT to reduce the risk of microvascular complications. While intensive glucose control reduces the risk of some cardiovascular disease outcomes, such as MI, it did not reduce the risk of cardiovascular death or all-cause mortality and increase the risk of severe hypoglycemia. It is important to remember that tight glycemic control may burden patients with complex treatment programs, hypoglycemia, weight gain, and costs. Clinicians should individualize HbA1c targets so that they are reasonable, reflect patients' personal and clinical context, and their informed values and preferences. A target HbA1c less than 7 is reasonable for motivated new diabetic patients with long life expectancies, whereas less stringent controls HbA1c 7.5 or higher may be reasonable in elderly patients with limited life expectancy and elevated risk of hypoglycemia. Higher HbA1c targets 8 to 9% are appropriate for older adults with multiple comorbidities, poor health, and limited life expectancy. In addition to controlling blood sugar, blood lipids, blood pressure, weight, etc. also need comprehensive management. The treatment of diabetes mainly includes 5 aspects, namely nutrition therapy, exercise therapy, education, monitoring, and medication. Diet and exercise therapy are lifestyle interventions and are used as the most basic treatment in diabetes. Next, let's learn how to eat for diabetic patients. The guideline does not recommend a special diet. However, newly diagnosed diabetics who are overweight or obese should be counseled to lose at least 5% of their body weight. Medical association therapy with a registered dietitian is recommended. The patient with diabetes can be started on 30 calories per kilogram of ideal body weight. This number can be increased to 35 calories per kilogram for an active person and 40 calories per kilogram if the patient does heavy physical labor. The calories should be distributed as 45% to 65% carbohydrates, less than 30% fat, with saturated fat limited to less than 7% of total calories, and 10 to 30% protein. Daily cholesterol intake should not exceed 300 mg. The emphasis should be on complex carbohydrates rather than simple and refined starches, and on polysaturated instead of saturated fats in a ratio of 2 to 1. Other principles in the diabetic diet include modest sodium restriction to 2,400 to 3,000 mg per day. If hypertension is present, restrict to less than 2,400 mg per day. If nephropathy and hypertension are present, restrict to less than 2,000 mg per day. Non-nutritive artificial sweeteners are acceptable in moderate amounts. However, it has been shown that artificial sweeteners may actually increase insulin resistance by affecting the action of insulin at the receptor level. Exercise is also an important part of lifestyle intervention. Exercise can increase the cellular glucose uptake by increasing the number of insulin receptors. The following points must be considered. Exercise program must be individualized and built up slowly. Consider beginning with 15 minutes of low-impact aerobic exercise 3 times per week, and increasing the frequency and the duration to 30 to 45 minutes of moderate aerobic activity to 3 to 5 days per week. In the absence of contraindications, resistance training 3 times per week should be encouraged. Insulin is more rapidly absorbed when injected into a limb than exercised, and this can result in hypoglycemia. Physical activity can result in hypoglycemia if medication dose or carbohydrates consumption is not modified. Ingestion of additional carbohydrates is recommended if pre-exercise glucose level less than 5.6 millimole per liter. Lifestyle intervention helps prevent the occurrence of diabetes. Low-fat diets with exercise reduce diabetes by 56%. Diabetes doctors and nurses need to provide education to patients. The content of diabetes education include recognizing the disease, the natural cause of diabetes, followed by the clinical manifestation of diabetes, the harms of diabetes, and how to prevent and treat acute and chronic complications. Setting goals for diabetes treatment, learning healthy lifestyles, individualized lifestyle interventions include diet plans and exercise prescription. Knowing the pills include oral medication or injection therapy. Keeping monitors to adjust the treatment plan. Patients need to be monitored in different time periods. Patients can usually use a blood glucose meter for self-monitoring of blood glucose. Glycated albumin can be measured in 2 to 3 weeks. HbA1c can be monitored every 2 to 3 months, and comprehensive review can be done every 6 months to 1 year. Okay, in this chapter, we have learned the lifestyle intervention of diabetes. Thank you very much.